Dengue fever is caused by the bite of the Aedes mosquito. And once bitten and the dengue virus enters into the body, that is a flavivirus, that causes various symptoms. It may cause simple fever, it may cause dengue hemorrhagic fever, it may cause even shock and death also. You see, the dengue virus is a virus that is prevalent as such. When Aedes mosquito bites a person who is suffering from the dengue, that that there is a difference between the male Aedes and female Aedes. The female Aedes mosquito survives on the blood. Male Aedes has the nectars and all to feed. Once they bite and they have the blood of the flavivirus, and when they bite again to another person and they transmit it, and that's how the dengue fever is spread. Dengue fever can be having very mild symptoms, say maybe body ache, fever, or maybe have a severe body ache, high grade fever, recurrent vomiting, loose motions, sometimes confusion, deranged sensorium. It may affect many parts of the body. It may cause decrease in the blood pressure, resulting into a shock and severe hemorrhages like blood spots on the body, and it can cause sometimes death also. Dengue can be detected in the early stages by one PCR method, is the earliest that we can detect. We can go for the NS1 antigen assay, we can detect early, or else you can go for the ELISA and detect the antibody. The earliest you can detect by the antigen assay and the PCR. Dengue fever is always treated symptomatically. For fever, initially you give paracetamol. For most of the patients, that's sufficient. They do not require hospitalization. If the platelet drops, for example, less than 20,000, if the patient bleeds, has got recurrent vomiting, loose motions, has deranged sensorium, you admit the patient. Patient may require platelet transfusion, IV fluid, symptomatic treatment, etc. But this is mostly symptomatic treatment. Dengue fever may not cause any symptom, or else may give fever that may range from 5 to 7 days usually, and usually the fever starts abating in the 4th, 5th day. But afterwards, the dengue that results may cause recurrent loose motions, vomiting. These all symptoms may carry on for 7 to 10 days also. Dengue fever, once the virus can, repeatedly saying, can affect most of parts of the body. If it affects brain, it can cause encephalitis, can cause convulsions, fits. If it affects the GI symptom, recurrent vomiting, loose motions, it causes severe muscle pains. Then sometimes we have seen it is causing even the myocarditis. That means the heart muscles become weakened. Patients have severe breathlessness. It can result into the water overload into the lung because of the capillary leak, resulting into the fluid we call ARDS, fluid pulmonary edemas, that can fill your lungs. So almost all the organs of the body sometimes can get affected.